We are waiting for the live coronavirus update for San Antonio and Bexar County. Yesterday, we saw a record number of new cases, 2,932 new cases, along with 70 cases that were backlogged. There were no new deaths reported on Sunday. We're now getting an update on the latest coronavirus.
Joined tonight by Dr. Anita Curian, who is our Assistant Director of San Antonio Metro Health, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 1,585 new cases of COVID-19, which brings our total to 135,104 since the pandemic began. Our 7-day rolling average is 1,769, which is nearly 500 more than just a week ago. Unfortunately, we also do have one new death to report tonight, a white female in her 80s, and we wish to extend our condolences to her friends and families as we do for all those who have lost their battle and their families they leave behind. This has been a devastating pandemic, as we know, and these numbers, all of them, represent a loved one or a neighbor. We have a total of 1,259 patients. 1,433 patients in the hospital, which is up 26 from yesterday and up 174 from a week ago. We had 142 new admissions in the last 24 hours, 392 patients in intensive care, and 229 patients on ventilators. It is Monday, so let's take a quick look at our progress and warning indicators. Our case rate has increased significantly from 64.8 last week to 86.4 per 100,000 this week. The positivity rate has declined from 23.2% to 19.7% this week, and hospital stress remains moderate. Last week, we also recorded a record level 59,690 tests administered in our community, including 38,000 at our free public sites. So the overall risk level for Bexar County remains severe and worsening. Before I hand it off to the judge, as you may know, Congress approved the $900 billion COVID relief package in December, which includes $284 billion for Paycheck Protection Program for small businesses. These are forgivable loans to help businesses meet payroll for their employees and pay eligible business expenses. Recognizing the need to get funding to smaller businesses and those owned by people of color, the Small Business Administration has implemented new targeted guidance to ensure funding reaches those that need it the most. The new rules have set-asides for first- and second-time borrowers with a maximum of 10 employees or those seeking loans less than $250,000. The rules also prioritize SBA's receipt of loan applicants from community financial institutions that work with smaller businesses and those owned by women and people of color. The PPP loan application portal opened this morning only for community financial institutions, which are in Texas, and those are Lift Fund, People Fund, and BCL of Texas. Small businesses should reach out to one of these organizations to apply for a PPP loan. And beginning Wednesday, January 13th, all other banks and financial institutions will be able to submit applications. Finally, we'd like to remind you that small business owners that we have many local resources to assist them in recovery. The UTSA, SBDC, and COVID Recovery Accelerator has business advisors on hand who can help with PPP loan applications and any other recovery-related questions. You can reach them by visiting txsbdc.org/businessrecovery or emailing businessrecovery@utsa.edu or calling 210-458-2272 to set up an appointment. Judge Wolf.
Well, thank you. Well, let me first of all say goodbye to my good friend Glenda Dice. We were friends for over 65 years and passed away last night with COVID. What's really bad about that, you can't say goodbye because you can't go to the hospital. His wife, Connie, was so frustrated with that. So you die alone. You die when a little red light goes on at the nurse's station. It's just a terrible, terrible way to get by without your loved ones being able to say goodbye. So say goodbye to them tonight. Well, the positive rate's down. That's good. From down to 19.7 from 23. And we're doing better than other metropolitan areas. Houston's at 26, Dallas at 31, and Tarrant at 30. So we're still got a lot of problems, but doing better than other. Mayor and I were both out today out at the site that the city of San Antonio is doing at the Alamo Dome. Very well organized, can go through in your car as well as go in. And it was so good to see so many people doing it. We now have the capacity between University Hospital, Bexar County Hospital, that we're doing out at Wonderland, and then what the city is doing, 1,500, we're doing 15. And then the two WellMed sites have some 1,500 they can do a day. So we can reach 4,500 just with those three sites. And as more of this comes on, we'll be able to reach more and more people. I know it's difficult now. I know it's a hassle to try to sign up and everybody trying to sign up at the same time, but it will get better, and I think we're doing much better in offering all of these opportunities than what they're doing in any other major metropolitan area.
Thank you, Judge, and our thoughts are with you and with the families of Len. We do also want to let you know we continue to struggle with dangerously low blood supply levels. Although donations have increased, the need for blood in our hospitals has been higher than expected. The South Texas Blood and Tissue Center reports that total local inventory is about a 3-day blood supply compared to a 5-day supply before the holidays. Type O blood in particular is at a critical level with just over 1-day supply. That leaves our hospitals with dangerously low levels to treat accident and other trauma victims. So, to help fight the blood shortage, our San Antonio City Council members are planning an SA District Challenge next week. Blood drives are scheduled in all 10 council districts, and council members are competing to see who can bring in the most donors. So please support this effort if you can, or schedule an appointment to give blood at one of the center's 6 donor rooms in the area. You can make that.
This briefing is continuing right now on KENS5.com and our Facebook page. There's 1,585 new cases and 1 new death. As far as hospitalizations, that number did go up, as well as new admissions. The risk level now sits in that orange, the severe level. Compared to other major cities in Texas, our positivity rate is not good, but better at 19%. And a quick correction on that phone number for the WellMed coronavirus vaccine clinics, that number to call is 1-833-968-1745. We'll be right back.